One of the common myths that people have about psychiatry is कि ये तो तुम्हारे मन में हो रहा है, तुम ऐसे सोचोगे तो सब ठीक हो जाएगा. And there is a medical reason why people are referred to a psychiatrist.
Frequently use something called as consistency. You have to be consistent throughout. Is this training your brain?
It was very scary for me to be in decision-making roles where I had to immediately split-second think कि क्या करना है. You need that defining moment that tells you when you felt that you should be a psychiatrist. For me, that defining moment came. But patients often ask me, should I go to a psychiatrist first? Yeah, is it okay if I go to a psychologist? I'm always like, you decide who you want to go to. Patients are a lot more aware. They have no hesitation in asking you questions. I think that builds better accountability for our profession also. Gone are the days where you say कि oh मैं डॉक्टर हूँ तो मैंने ये बोला है तो लेना ही पड़ेगा. Parents of patients coming and telling me कि हमारे टाइम में तो ADHD, autism ये सब कुछ तो नहीं था, अभी इतना क्यों बढ़ गया है. So stressed is still a milder word. People come and say depression. मुझे OCD हो गया है. And I'm like क्यों भाई क्यों लग रहा है OCD हुआ है. They go with that prescription to the chemist. The chemist says अरे आपको इस दवाई की क्या जरूरत है.
Great minds don't just think. They evolve, inspire and transform. Welcome to yet another power-packed episode of the Visionary World podcast, where we unlock game-changing ideas that drive the future of business and innovation. I'm Amrita Sengupta, director and co-founder at 36 Skills. We have an extraordinary guest with us. Dr. Wilona Annunciation is a distinguished psychiatrist, mental wellness expert, and a corporate trainer with over a decade of experience in fostering emotional well-being. With an impressive background in psychiatry and healthcare business administration, she specializes in empowering individuals and organizations through emotional intelligence, burnout prevention, and workplace wellness. In today's conversation, we will explore the power of mental well-being, the science behind resilience, and how we can create healthier, more fulfilling lives. For an insightful discussion that just might change the way you think about your mind and your potential. Dr. Wilona, welcome to the Visionary World podcast. It's an immense pleasure to have you here. And you look lovely today.
Thank you, Amrita.
When I heard your name for the first time, Wilona is a very attractive name. The surname that is there is Annunciation. I would like to understand the meaning of that word.
Okay. So, the Annunciation is actually a biblical event in which the angel Gabriel announces to Mother Mary that she's going to be carrying baby Jesus. So, that's the background to the name. But for me, the name came out of my marriage to my husband because that's his family name and that's the name that I adopted after marrying him. And so, it's quite a unique name. Even among Christians, it's something that is a rare surname. So there are very few of us that are there in the community.
Okay. Very interesting. To begin with today's podcast, I would like to start with, understanding your journey into the psychiatry's domain, your where you went to college and how did you pursue the dream of becoming a psychiatrist and then starting your own clinic here in Thane. So would you just, like to take us through your journey?
Sure. Ever since I was a little girl, I always remember I wanted to be a doctor. That was the first dream that I had. And growing up, whenever any of the aunties, uncles would come home and ask me, "Beta, kya banoge?" I would always smile and say, "मैं doctor banungi." And so it was a no-brainer. After 10th, I got the percentage that I wanted to. I got into one of the junior colleges, which was very close to home. I say very thought out ki I will study properly. I will do a medical entrance and get into one of the top colleges in Bombay. And when I got into JJ, it was like a dream come true. It was a little bit of a downer for me when I went roaming around the medical colleges of Mumbai, So my dad is a very organized person and he said, before we start your medical school, you should go and see all the colleges in Bombay and see how they operate. So we went to KEM, we went to Sion, we went to Nair, we went to JJ, all the hospitals we visited. And out of that, JJ had the most old, dilapidated structure where we had the, admissions to be taken. So I was a little scared because I was like, okay, दुनिया में everybody is using laptops, यहाँ पे typewriter पे अभी भी काम चल रहा है. And I was like, okay, I'm going to do like 5.5 years of med school here. So it was a bit scary, but once college started, it was amazing because JJ was something that really shaped my ideas of what I wanted to be as a doctor. When I entered JJ, I remember thinking that I will do something either in gynecology and obstetrics or I will do pediatrics. Those were two fields that I was very interested in. In our second year, we are supposed to go around doing postings in hospitals. So when I did the actual postings is when I realized I'm not cut out for any emergency branch. That's when I realized that I'm someone who is very anxious, someone who's full of doubts, who, you know, when the patient comes in front of her is like, okay, ye bhi possibility hai, ye bhi possibility hai, ye bhi hai. So it was very scary for me to be in decision making roles where I had to immediately split second think ki kya karna hai. And around the same time is when I met my now husband. Then we were dating, and I was also very drawn to the way his family spent time. They were very close to each other. They are very close to each other. They spend a lot of time together. So I then realized that I also want a really balanced family life. Okay. So by the time I finished my MBBS, I had only two clear options in my head. I would either take MD Skin or I would take MD Psychiatry. Okay, these were the only two options that I opened up. And I remember doing my entrance exams for PG and my dad filling out forms with me and telling me इंटरनल मेडिसिन के 6 सीट्स है, सर्जरी के 8 सीट्स है, साइकियाट्री का 1 सीट है, डर्मा का 1 सीट है. Will you even get in? You know, that was the worry. Around that time was also when I decided to go ahead and get married. So we were dating almost for 6 years throughout medical college. I met him in the first year of medical college. Then we were dating for the full 5.5 years. So it was just a natural decision that, okay, we'll get married and then I will do my PG. One of my fears and one of my parents' fears was that shadi ke baad she won't do her PG and, you know, she will sit at home. So that was something that I discussed with both my husband and my in-laws, that no matter where I get a PG seat in India, in the whole of India, wherever I get it, I will go. And they were extremely supportive of that decision. So that also strengthened the idea that, okay, I want to go ahead and do PG in a place, in a field which allows me to have a good family life as well. So I can come back home, I can spend time with my family. I love doing a lot of things. I should be able to do all of that. And when I got MD Psychiatry, we were together. He took me to Bangalore for the counseling for the MD seat. And when we were sitting and we were seeing, okay, baki fields bhar rahe, seats are getting filled up and psychiatry is remaining. And then by my rank, we got the MD Psychiatry seat. He called his dad and he said, she's going to Mangalore. She's going to do the MD. It was a very difficult time for us, I think, those 3 years. But, you know, you need that defining moment that tells you when you felt that you should be a psychiatrist. For me, that defining moment came after I started psychiatry. Because when I went into Mangalore and I went into my college and I started working with patients, there were a few that were studying with me that took psychiatry as a last option because they didn't want it and they did not get any other option, and then they finally took up psychiatry. For me, it was not like that. I had come because I wanted psychiatry. And when I started working with the patients, I realized I had a natural flair for it. It was just easy for me to listen to them, to ask the right questions. Nobody needed to train me ki, okay, is situation mein ye puchna chahiye, aise karna chahiye. It just came very naturally. And that's when I was like, okay, this is where I should be. And I was really happy with the way my course went. You know, the whole practice of psychiatry with learning all the medications, learning how to use them, learning when to use them, learning how to talk to patients so that I understand which specific medicine is suited for their needs. And around that time also was when we took some major decisions in terms of moving our life forward. And we were very fond of kids. So we also thought that, okay, we should go ahead, you know, in terms of, we were dating for 6 years before marriage. We already had spent about a year together after marriage. And then I got my seat. So we had decided that, we want to move ahead with our family as well. And that was the second good decision I think that I made, that I would go ahead with my family during the course. And because of that, I finished my MD in 2013. And while I finished my MD, I was also expecting my second baby. And so I took a 6-month break post MD, during which time I delivered my son, helped, take care of him in the few early months, and then started observership with a few senior practitioners in Thane, which gave me the flexibility to go home. So, all in all, a year down the line, post MD, when I was ready to start my practice, family was already set. So I could then build on from there, start my work, because the initial years were very demanding. And from there to now, where I have my own practice, where I have a team of people working with me, it's been a long journey, but I would say it's exactly the way that I wanted it to go. So I'm really happy to be where I am now.
Thank you for sharing that story with us. Where did this clinic thing, the Catalyst Clinic idea pop up into your head? That I want to go bold now. I want to go, up front and set up my own clinic so that I can serve the people.
I think the idea was already there in my mind at some level. Even during my MD, I studied in Father Muller's Medical College in Bangalore. Mm-hmm. And while I was studying there, psychiatry department, the location was not an ideal location at all. So it was the ground floor, but it was sub-ground in the sense that we had to climb downstairs to go into that area. So sort of like a basement. There was barely any sunlight coming in. It was a very dark place to come to if you needed help. And I believe that people coming to us for help need so much of light and sunshine in their life that it's just not okay for them to come to a place that makes them think more about the gloom and the sadness and the despair. I had this idea that whenever I start my place, it has to be this airy, bright, open, comfortable space where people can come and sit and talk and easily have discussions. And when I started taking training programs, the natural flow from those programs was, Acha, what you said today made a lot of sense, and it has helped us think a little bit about what we are going through. So if we want to consult you, where can we come? And that's where it started. I was working with NGOs before I started my practice. So there was always the option that they could come to me there. But that wasn't my space. That wasn't made the way I envisioned it or the way I wanted it to be. I also work with a bunch of very talented professionals. So I wanted to be sure that they were also given the space that we could collaboratively work with so that they are able to cater to the needs of my patients. I'm able to help their patients. So I wanted a space that would allow us to do this. And that's when we were looking for space to invest in for the clinic, initially we were thinking much smaller. But I think it was just supposed to happen that we got an option to buy a bigger space. Things aligned and I was able to get that space into place. And then with the support of my family, with the support of interior designer who helped actually bring that vision to life, today we have Catalyst Clinic. So that's where it is.
I visited your clinic. It's really good. It's all airy and all lighty, as you mentioned.
Yes.
And nobody would feel gloomy. And, it was like you come, sit there, talk to the doctor, get your stress out. Halfway, the patient is happy there.
Absolutely. Even before coming into meeting.
Yeah. The environment around us plays a major role.
Yes.
Yeah. You rightly mentioned about your journey towards the whole flow of psychiatry. You went to college and then how you did your MD and finally, setting up a clinic. There must be some myths. अरे psychiatry क्यों लेना है? Sort of a thing. मतलब वो तो last option है मेरा. But for you, it was the first option.
So I think from the perspective of medical students, it needs to be a willing choice that they want to make. And today I see that shift happening. I see a lot more youngsters willingly taking it up as an option that they would like to work on. One of the common myths that people have about psychiatry is, man mein hai. So it's not real. That is one of the most common myths. कि ये तो तुम्हारे मन में हो रहा है तो तुम ऐसे सोचोगे तो सब ठीक हो जाएगा. That's the common concept that people have. And I think even among medicos, this is a common issue. Because there are so many times when I've had a gastro colleague or a gynec colleague referring a patient to me saying, yaar Wilona dekh ye patient ka na maine sare test kar liye, this is the problem. They've been coming to me, say for example a gastro person who's saying that they have a patient who has acidity, okay, and बहुत acidity हो रहा है, nothing seems to be settling down the acidity, we've done all the tests, everything is clear, एक बार तू देख ले and तू counseling करके देखना. So this is a very common myth that people have कि because it is psychiatry, it's all resolvable with counseling. I think the shift now is happening because people are identifying it as a neuroscience. So there is a huge dynamic that gets people to understand that there is a medical reason why people are referred to a psychiatrist. And once they have referred and they see results, then they feel the confidence in continuing to refer. So the most common myth is that because it's in the mind, it's not really biological. This is something that I've been combating all my life as a psychiatrist, that I keep saying that it is biological. Even if a person decides to change the way they think, that is a neuronal change that is happening inside their brain. So it is not just, I thought ki alag se karna hai. Okay? It's like any skill that we develop, right? So riding a cycle. The first time you ride a cycle, you will make mistakes. You will fall off the cycle. The cycle will not go the way that you expect it to go. But you keep doing it. And so the brain networks get trained on it. They get trained and trained and trained so much that it has now become a network towards your thigh muscles, towards your hand muscles, towards your grip, your eye coordination. Everything is working seamlessly. And this is happening because the brain is the mastermind that's actually coordinating all of this. That's the director that is controlling all of this. So when you keep doing it, it becomes so seamless and so automatic that at a point, even if you wake up in your sleep and say, chalo cycle chala lo, you'll be able to do it, right? And that requires proper neuroscientific techniques. But because it is happening so easily, we don't even realize how much our brain is doing in that process, right? But if you have an injury that damages that part of the brain and you lose that skill, that's when you realize, oh my God, this was so important. The rest of my body is functioning fine. Just because of that small injury in that small part of the brain, now I'm not able to use this and I'm not able to manage it. So the myth that people have that psychiatry is all about counseling, all about just talking to people, all about just getting them to, say, address something in their past, something in their childhood, something that somebody has done to cause problems for them, is definitely a myth. It is neuroscientific. It is based in the principle that your genetics, your personality, and the stress that you're dealing with all come together to create a particular illness for you. And there are scientific ways to deal with that illness. There are scientific approaches to manage the concerns that you experience, and then you treat them so that you come to better emotional, physical, psychological functioning so that you are at the top of your game.
So there is this term we very frequently use, something called as consistency. You have to be consistent throughout. So is this training your brain? Are there any steps, or it comes naturally to us, or how is it going to happen?
That's a fantastic question, actually, because consistency seems to be one of the challenges that comes to me in the clinic very frequently. Like a lot of people who come to me and say that I want to start this habit, but I'm not able to do it. I want to get into a better sleep routine, but I'm not able to do it. I want to exercise regularly, I'm not able to do it. So consistency is an aspect of your personality that part of it is genetic and, your personality core traits. Okay, so you may know a few people in your life who, no matter what, रोज सुबह उठ के एक पर्टिकुलर रूटीन फॉलो करेंगे. ठीक है, समटाइम वी मेक फन ऑफ दीज पीपल सेइंग दैट दे आर वेरी बोरिंग एंड वेरी प्रिडिक्टेबल. सो कंसिस्टेंसी इन दैट सेंस,
सुबह 5 बजे ही उठना है.
हाँ, बिल्कुल बिल्कुल. नॉट नथिंग, नॉट 4:59, नॉट 5:01. 5 बजे ही उठना है. बट फॉर दोज ऑफ अस हु डोंट हैव दैट trait, and I'm one of those definitely who doesn't have like a lot of I've struggled with consistency for some time. For us, the hope is that, you take it as a habit learning, right? So you help your brain train on that habit time and again. For me, exercise has always been a challenging area of developing consistency. So while I love physical activity, it is something that really energizes me, and I know that it helps me settle down any kind of emotional distress I might be experiencing. Doing it consistently has always been a challenge. Initially, it was trying out different gyms that didn't work. Then said, okay, let me do swimming because I love swimming. So let me do that. Even that didn't work after a point of time. I think what really helped was in the pandemic when I realized that I was just not moving because I was at home and I was doing things around the house but not getting any physical exertion as such. That's when I decided to find this trainer, and working with him has really helped me build up, some consistent habits. I'm still not where I would like to be, but if you look at over the years, the movement has definitely improved significantly from where it was in 2020 to 21 to 22, now to 25. So there is definitely an upward trend. And that's what I would encourage people to look at, So look at the bigger picture, not only at the micro picture when you're looking at consistency. Say you started with, I will do this 7 days a week, but that's unrealistic. And you are able to manage 3 days or 4 days a week as against 1 day a week. You're still way better than a lot. You're way better than 50% of the population, I would say. From there, you build it up to 3 to 4 days, 4 to 5 days. So one step at a time. The important trick with consistency is to always get back.
Yes.
Because there are breaks that will come, right? We do our holidays. Suddenly there's a medical issue in the family. There is a visitor that comes home and, our life goes upside down. Or there is a crunch time at work. And then your whole अच्छे से planned routine goes for a toss. ठीक है, it will go for a toss temporarily to be able to accept that and to say, okay, 15 days, na, uske baad let me get back on track. So that's the important thing. So I keep doing these reset modes, like March was really bad for me in terms of my physical exercise. But I've told my trainer that I will start from 1st April. And instead of waiting till 1st April, 30th ko hi I started by taking a walk. I said, let me do that. And tomorrow onwards, I'm going to meet him and start with the gym. So he, of course, gives me 3 days a week, but the rest of the days are in my hand and I can do something about it. And so I keep putting myself on that reset track. Ki, come on, let's start again. So I'm not as consistent as my dad, who would probably walk every single day. But I'm way better than what I was in 2020. So that's the goal. You keep getting better and better and better, and you will reach that point where you feel, okay, this is where I'm comfortable with my life and this is where I want to be.
This is a very good advice for our audience that you have given. Medication versus therapy. These are the two different aspects of psychology. And psychiatrists, I think, on daily basis are dealing with this, that patients are coming and telling only therapy is needed, or maybe only is medication or even required for me. And there is this stigma also within the families, or, medication se to kuch nahi hone wala, therapy se kuch nahi hone wala.
Every single patient that walks into the clinic, right, unless they have had an experience with medications before, or they have been in therapy for a really long time and are struggling with a lot of distress, apart from that, every single patient walks in with the idea कि मुझे दवाई नहीं चाहिए. That's the first thing that they tell me when they come into the clinic. Having worked in first a setup that was core medication, right, where I trained, it was a medical hospital. My professors and teachers all emphasize the need for medications, which is absolutely right. There's nothing wrong there. But I didn't have an orientation to psychology when I was studying. It's when I came back to Thane and I started working with an NGO in Thane called IPH, under the guidance of my senior Dr. Anand Nadkarni, I learned that medication to medication ka kaam karega, right? You give the patient medication. If they've been crying, the crying spells will reduce. If there are suicidal thoughts, that will reduce. If there are anger outbursts, that will reduce. If there's panic, that will settle down. So the medications will do their bit. But what helps the patient come up to that level of functioning where even when I wean off the medication, they are able to function? And that's where therapy is very, very important. So now in all the places that I practice, the work is collaborative. I start medication, I do the initial assessment, I do the risk evaluation, I figure out what is the plan of treatment, I start the medication, and then I also recommend that they would do therapy, or they would get some tests done, or they would start with a particular kind of treatment that is necessary. So it's a collaborative space where mental health practitioners work together. My work is not greater than their work. We all work collaboratively together. logically the hierarchy is that the doctor decides which is the line of treatment, okay? But patients often ask me, should I go to a psychiatrist first? Yeah, is it okay if I go to a psychologist? I'm always like, you decide who you want to go to, right? If your professional is good, they will tell you कि यहाँ पे therapy काम नहीं करेगा, you have to go to a psychiatrist. And that has happened with so many of my colleagues. Patient has gone to them for counseling, has spent 2 sessions crying throughout the session, not being able to move forward in terms of, okay, what are the steps that we need to work on? And they have gently told them that, listen, I can help you, but it will take time for my work to start. And before I start, it is important that you go to a psychiatrist. And they have come, they have started medications, and they felt better. So it's a collaborative practice. They need to have the right treatment at the right time. And the decision for this is made based on severity, based on how much their life is getting affected by the symptoms that they are experiencing, based on genetics and personality factors. So it's a comprehensive evaluation that we do the first time. Basis that we decide whether to give medications, whether to give counseling, whether to ask them to do any further testing. Okay. One important aspect here for people to remember is, just like if you were diagnosed with diabetes, right? The first thing you would do is lifestyle modification. You will cut down on sugar, you will cut down on oil, you will try and exercise a little bit more. So lifestyle modification is an important part of your treatment in psychiatry as well. So our 3 arms of treatment are medication, therapy, and lifestyle modification. And when a patient does all of these, there is no reason why they can't recover from the distress that they are experiencing, and why they can't have better quality of life.
So there is mind and body. So mind has one more aspect of therapy added, whereas body is medicines and changing lifestyle and all that.
So both mind and body have medications as well. Like the medications affect the way you think, the way you respond to the situation. But just like the body, like for example, if you have a fracture, right? The orthopedic surgeon will fix the fracture, will give you a cast or maybe do an operative fixation. And post that, you will go to the physiotherapist to learn how to move the joint better, correct? Similarly, with psychiatry, the medications will help heal the distress. The therapy part will help you focus better on managing with the concerns, coping better with the challenges that you're facing, and building better resilience strategies for the future.
Is there any patient of yours throughout these years of your practice who has, changed this, has come out of it and made you proud? Okay, something that I'm doing is actually making sense to the society.
Actually, there are so many of them, there are so many that every month message me and tell me that I cleared my CA exam, I got into medical school, cleared off the loan that was giving me so much trouble. Me and my wife have got back together and I'm so happy that things are okay. Or my child is now got admission in the university of his dreams and is going to do his studies further. Or even, my mother could not sleep peacefully for so many years. Now, thanks to you, things are so much better and she's having so much better quality of life. So these stories are every single day where, people have overcome obstacles and challenges that they thought were insurmountable, and they've crossed that and they've reached a path where they are, doing really, really well.
So everywhere you go, you have social media. It's like your it's like air you breathe right now. Is it making things worse, or or it is taking things in a good way? Is it overrated or underrated? How is it affecting your profession or the patients that come to you? Especially different age groups that come to you.
Okay, I would say social media has its pros as well as cons. So on the benefit side, I would definitely be very happy about the dissemination of information. That's amazing.
Yes.
People from far reaches of the country who have, say, maybe seen a recording of me or who heard about me from some family member are now able to access me simply because of the use of so much of technology, which otherwise would not have been possible. Patients are a lot more aware. Patients are a lot more real about the concerns that they have. They have no hesitation in asking you questions. They go back, research, they come back to you with, okay, this is my doubt. Should I be taking this? Should I not be taking this? I think that builds better accountability for our profession also. Gone are the days where you say कि, oh, मैं doctor हूँ, तो मैंने ये बोला है, तो लेना ही पड़ेगा. Now you have to justify why you're doing it and why you're giving it. And I think to a certain extent that's fairly valid, because if I went to somebody, say I went to a financial planner, I would want my questions answered. So it's fair that they would come to a doctor and expect their questions to be answered. In that sense, I think it's a beautiful space. It allows people to talk. It allows people to express their views without being scared of, what the repercussions are going to be. And it has enabled a lot of people to question certain things which were otherwise just accepted myths, Parents of patients coming and telling me कि हमारे टाइम में तो ADHD, autism ये सब कुछ तो नहीं था, अभी इतना क्यों बढ़ गया है? तो my answer to that has always been कि वही disorders तब भी थे. It was just, you were not aware of it. Today the school is aware. Social media is making sure that you are aware, so you are attending to concerns much earlier, which otherwise would have come in 8th standard because the child is failing in the subjects. Now you're coming in 2nd standard and 1st standard because you realize there's a problem. So awareness is definitely one huge boon that social media has given to us. The flip side of that is, with the awareness comes a lot of overthinking, comes a lot of over generalization, like everything is this or everything is that.
So if somebody says I am stressed, so they are just generalizing stress as in...
So stressed is still a milder word.
Depression.
People come and say depression.
Depression.
People come and say depression. People come and say OCD. मुझे OCD हो गया है. And I'm like, क्यों भाई? क्यों लग रहा है OCD हुआ है? Tell me the symptoms. They are like, no, because I have obsessive ruminations. I have a lot of magical thinking. I have a lot of obsessions and compulsions. And I'm like, okay. Break it down to what do you mean by obsession? You tell me what you mean. Because when they talk like that, then I am able to decipher कि ये सच्ची obsession है, या it is overthinking on their part, या it is just simple plain anxiety. That's my job. So then I have to tell them कि hang on, let me do the diagnosis. You tell me the symptoms. Okay. Similarly with ADHD, now it's such a buzzword. A lot of the younger generation come to me with, I think I have ADHD. And I'm like, sure, let's evaluate. But it may not only be ADHD, it could also be your personality. It could be the fact that you are not able to, focus because you are worried about something that is stressing you out. It could be something else completely that you don't even realize. There was one patient that came to me saying that she had a lot of difficulty focusing. I said, have you got your blood test done? And she hadn't. So as a protocol, the first time a patient comes into the clinic, if they haven't done a scan of the body, I usually ask for certain blood tests. So I got the basic recommendations done, and their TSH levels were 15.
Oh.
And I was like, with a thyroid at that level, the thyroid hormones were lower, so TSH was high. And I said, with the thyroid at that level, you're not going to be able to focus.
Yes.
Like, go meet an endocrinologist, settle it down, come back to me in 3 months. If you're still having focusing issues, we'll test, right? But
sometimes the problem is somewhere else.
Exactly.
They don't realize, and everything is related to depression,
or
anxiety.
Yeah, or some particular thing because they've read on social media, and somehow when we read something, we feel it applies to us, right? So we read something about, say, focus related issues, and we're like, okay, I have this. मतलब मुझे ADHD है. But what they don't understand is, for me to be able to make that diagnosis of ADHD, I've done 5.5 years of medical school, then 3 years of MD, then 10-15 years of practice, and तब जाके आज मैं ये चेयर में बैठ के बोल सकती हूँ कि ये ADHD है, ये ADHD नहीं है. So social media cannot replace the learning that you have from, actual studying, from the experience that you have working with patients, and of course the learning that comes from actually working in the scenario and seeing what is what and, what is not the concern.
I have a very interesting question here. Will AI replace... So what is happening now? You go to a site somewhere, you have a certain question, you type it, the AI bot is replying back to you.
Yes.
Is it going to be the same for us humans as well with respect to our mind?
I'll ask you this question as a follow-up, right? Because I am on the other side and I am on the medical side of it, right? You are the consumer end of it.
Yes.
So if you had to go to a doctor, who would you prefer?
I would prefer a human, definitely.
Why?
A doctor.
Why?
Because like you mentioned, you have done this study, you have gone through all of that throughout the years. You are a human, you'll give real expression, real sense out of what I am feeling. Also, you must have experienced the same kind of emotions that I have experienced at some point of time. So maybe it would be relatable. Of course, an AI bot would be fed with all that data.
They would be trained.
They would be trained. But
Yes.
what if something new comes to me up? Comes and then that particular thing only I think a human would, even if you would not have the answer right there and there, but again if I follow up with you, or if you refer me to somebody else, the human touch is there over there, and it is the right thing to do. But this is my perspective. What about the people out there? Google Baba is doing its job. I can't sleep in the night. I will Google it. What are the reasons I cannot sleep in the night? And then this is a tick mark. मेरा checkbox हो गया. And that's how it is. So next is chat GPT को पूछने लगे अरे मेरे को नींद नहीं आ रही है रात को. So, और वो free में भी हो रहा है ना उनका काम.
बिल्कुल.
They are just using a free tool to its fullest. Like I am a coder, so I'll ask give me if else statement. Similarly, they will, if I don't eat, what will happen? If I don't sleep, what will happen? They are asking
those questions.
Chat GPT. They are asking dating questions. This how would Chat GPT help you? The patients come to you and say कि अरे ये पहले तो नहीं था, अब कहाँ से आ गया? अब तो उसमें और add on करने के लिए AI आ गया है.
I am very enthusiastic about tech. Okay, मतलब it's not that I don't believe in AI, I don't believe in tech. I was one of the psychiatrists who was doing video consultations way before others were doing. So when the pandemic hit, I was already set. I had my Zoom, I had my Google Meet, whatever mode the patient preferred. I'm flexible across modes. I had my payment modes ready. Everything was ready. So barring that 1 week where our Prime Minister asked us to take chutti, I was working throughout the pandemic. Bilkul. Other than that 1 week where I rested, I believe AI has a role in definitely data collection. Okay. So I'll tell you where I get stuck. I have 24 hours in a day, right? I believe that I should spend time with my patients and I should spend time answering their doubts and questions. Okay. But I need a lot of information that I need as a psychiatrist. Like I need unke bachpan ka history, unke education ka history, unka medical history. All of these data I need. Okay. Right now for me, the way I get this information is I have a psychologist who is training with me, who trains with me for 6 months. So she learns the way I want that data gathered, and then she or he will take the history from the patient the way I want it.
So it is done like a vocal thing, like we are
Yes,
talking.
like a conversation. Either over phone or they ask the patient in the clinic to sit with them in one of the other consulting cabins and they take the history. Okay. So I feel there is scope in these areas where there needs to be data that is collected and there are specific points that need to be asked.
Do you think the AI bot will ask the right questions to get your right answers?
Not yet, but it can be trained is what I feel. Because there are a certain flow of questions that can be generated based on, there are certain questions which are standard.
Generic questions.
Which are generic. Like, आप सोते कितने बजे हो, आप उठते कितने बजे हो, नींद का quality क्या है. So these all can be fed and can be trained into the, the AI system. So I feel certain things can definitely be delegated to AI, which will save me a lot of time because right now I am training a new psychologist every 6 months. Yeah. And the reason I've insisted 6 months is 2-3 महीने में वो train हो जाते हैं, but 3 months then I can get the output from them the way I expected. The first 3 months, of course, they also need to train. If I do something like this, I'm saved of, training somebody every 6 months. It doesn't work for my field because right now psychologists need this exposure. So it's a win-win for them, it's a win-win for me. So both of us collaborate and do it, right? If I train an AI bot, it will be much easier for me, life will be much simpler. But one, my child patients will struggle because they're very distracted. So my psychologist will be able to, acha chalo, let's play this game and then you answer my questions, right? That maybe an AI bot will not be able to do.
Age factor comes into play.
And my older patients might not be comfortable interacting with the device.
Also using it is another problem for them.
Correct. Which is easier when there is a human being that is there, right? So I feel there is certain niche areas where it will work really beautifully. But wherever there are challenges, there will be challenges, okay? I do not think it can replace the wealth of information that a practitioner with so many years of experience has. Because that has come not only from the data gathered from so many patients, which has then helped them streamline their processes, but also from their own personality. Okay, like I'll tell you here, one thing that really shaped the way I work was when I was talking to a patient who was a bipolar disorder patient who had a history of almost 30 years. Okay, the family members crying in front of me and saying, we are fed up. We just want to put him in one hospital and leave him there, and we don't want to take care of him. We're fed up. That is how they talked. And it struck me that more than the patient, the family members also need help. Because the patient is so struggling, that we all understand. The family members are also struggling with them. ये नहीं सो रहा है, वो भी नहीं सो रहा है. ये खाना नहीं खा रहा है, they are also stressed. Like, if a child is not eating food, the mother comes and tells me, ma'am, मुझसे नहीं खाना जा रहा है. Because वो नहीं खा रहा है खाना. So, that was what formed the crux of my practice. Ki if I don't cater to the families, then there's nobody addressing their concerns, right? So, this is where I don't feel AI will help. Because there are so many cues that I see reading the body language of the room, you know. Like the patient is sitting in front of me, the family member sitting behind shaking their head, saying, you know, this. So then I'm like, okay, आप 10 minute बाहर रुको, मुझे आपके parents से बात करना है. You know, and I take that time to say, I know you're really struggling, but hang on, let's try and figure out how best to help your kid. So this I don't think AI will be able to do. I don't think. I don't know. Matlab, tech is advancing at an amazing pace. So if it does come up with a solution for this, fantastic, because I can't be in 5 places at once. So if I'm able to, and I had an interesting conversation with someone from the AI field at our annual national conference, which happened in Hyderabad in Jan. And he was talking about creating AI avatars of me that would speak to different patients. Now, I don't know how my patients will take to this, but if it does work, it's worth exploring. I don't have a closed mind to it. I don't think it will really give that same experience though. So, I mean, it's an exploratory idea. Let's see how it goes. And we are still a population that prefers, like India still wants the human touch. I don't think we have gone to that point where we would be happy interacting with machines. We aren't. I am one of those psychiatrists that gives their number to patients. Okay, so all my patients invariably have my number, which a lot of my fellow colleagues are like, why do you do this? The reason I do it is because I know that there are 100 doubts that come to their mind, which nobody but I can answer in a manner that will settle them down.
Great. You're still, you want to stay in touch with the patients, in and out. Matters.
All the more because everywhere outside they only face stigma. They go with that prescription to the chemist says, "Arey, aapko is dawai ki kya zarurat hai?"
Even the chemist.
Yeah, even the chemists.
Okay.
Even the family members. Like a lot of times the family members well-meaning, but they will say, "मुझे नहीं लगता तुमको इस पे dependent रहना चाहिए." Without understanding कि it's not dependency, it is actually a
Curing
biological...
yourself.
Yeah, it's actually a biological need of the body. So it has a certain duration that it needs to be continued. So there are a lot of these stigmatizing encounters that people have that make it very difficult for them to access treatment. And when they finally do, it's with so many doubts in their mind that they come to me. And I have spent time addressing all those doubts, answering all their queries, and then they go back. And then, somebody says something and then it shakes that foundation again. So then again, they want reassurance from me because nobody else is able to give that reassurance to them, right? So I think that connect has really helped. I think it has built a very good rapport with my patients where recently there was a patient of mine who was struggling a lot. He has been struggling for years, and after a very difficult time this time, he attempted self-harm. Okay, and he was hospitalized. So they called me at 4 a.m. My phone was on silent, so I didn't take the call. But as soon as I woke up at 6, I think I called them back and I said, admit. And they had already taken him because that was the protocol we had decided. Ki aise kuch hua, to take him to the nearest hospital, admit. They had taken him, they had admitted him. And they did the whole treatment. And, even while he was in the hospital, the family was in constant connect with me through messages. Very respectful family. They don't call me, they just message. And they leave it there. And I respond whenever I'm able to respond. And after discharge, when they went back to the physician, so obviously because they were admitted in a hospital and I'm not a consultant there, they asked me what to do. I said, whoever is the consultant there, let the psychiatrist see you. The psychiatrist saw, adjusted the medicine thoda sa and said, okay, once you're done, you go back to your psychiatrist. So post discharge, they came back to me and they said that the physician was asking कि इतने साल इतनी दवाई की क्या ज़रूरत थी, so see, now the physician has seen him only for that. I admit that they have seen him in a crisis mode, right? But they haven't handled him for 9 years that I have handled. They haven't seen the ups and downs, the sleepless nights the family has had because they were scared that he will attempt, and this is the first time he has
He
attempted.
already did it now.
Yeah, after 9 years of treatment, this is the first time that things got so bad that he attempted.
Yes.
So people feel that it is something that is so easy, that is so simply curable. Even with diabetes or hypertension or thyroid, doctors treat it for years.
Yes, yes.
एंड ऊपर जाता है, नीचे जाता है, तुम्हारे फैमिली में वेडिंग है, शुगर ऊपर गया, तुम्हारे फैमिली में किसी का एडमिशन हो गया हॉस्पिटल में, तुम्हारा शुगर डाउन हो गया,
वेडिंग है तो पैसे खर्च हुए तो स्ट्रेस
हाँ,
भी तो
स्ट्रेस
ऊपर
भी
गया.
बढ़ गया, करेक्ट. सो
तो
थिंग्स गो
उसका
अप
कौन
एंड
करेगा
डाउन.
इलाज?
या एंड वी डोंट सिट एंड से ओ आपका डायबिटीज का इतने सालों से दवाई चल रहा है. इट्स एन अंडरस्टैंडिंग.
Are these medicines very expensive, or common man can afford it, or how it is?
So there are a range of medications available, right from extremely affordable to extremely expensive. Both ranges are there. Okay, it depends on what your particular choice for that particular patient is, because sometimes there is a need to use something that is expensive, and that's when we talk to the patient
Some
and
combinations
say
of
that
drugs.
a specific molecule that is available, or a specific patent that they have, which the pharma company has, which allows them to market it in that particular way. But there have been times when patients have come to me and said, hey doc, can we look at an option that is a little more reasonable, or this is what I can afford, especially when they are students, or when they are at a stage in life where they need, financial assistance. They might want to consider medications that are reasonable, and all our government colleges have medication options that are very reasonable. Even when I prescribe, I'm very mindful to make sure that the medication is within the affordable range for the patient. Giving them clarity in terms of how long it will continue also. Because say a medication costs 1,500 for the month, right? For me, it may seem like, oh, it's not such a big expense. Yeah.
But for them
but
it is.
Yeah, but if you're looking at 1,500 a month for 6 months,
It is.
that's a significant amount of money. That's 9,000 bucks. So are you willing to spend that much? Are you able to spend that much? Is a question that I need to ask my patient. And if they are able to manage it, then yes. If they are not able to manage it, then there are options that I can shift them to. Sometimes, in fact, the patients have settled with something that is very reasonable, and we've never needed to go to an expensive option. So that's also a choice that we have. As a rule, I always start with the reasonable medication. If that works, then we don't need to go to something expensive. If it doesn't work, then we say, okay, now this is the other option that we have. It's a little more expensive. Let's try it out for a month and see if it works. There are times when the patient has come back to me and said, this is expensive, but it has given me the best results that I've not had in so long. So I would like to continue it. And then I've talked to them about long term. I've talked to them about costs. I've sat them down and said, okay, this should not be the reason that why your stress increases. So be mindful that this is what it is, and you need to be careful about what you're doing. So that's when we decide whether we want to go ahead or not.
What about the consultation charges around? Generally people are also having that fear. Oh, this doctor is going to charge this much.
Yeah. Depression तो अमीरों की बीमारी है.
मेरे पास तो पैसे ही नहीं है.
डिप्रेस होने के लिए पैसे नहीं है. साइकियाट्रिस्ट के पैसे भरो, दवाई के पैसे भरो, थेरेपी के पैसे भरो, फिर टेस्ट बोलते हैं.
डायबिटीज है तो उसके भी पैसे भरो.
Yeah. So yes, I agree that it is expensive, because in that sense, mental health support requires multiple professionals to work together, right? So it can cost, but there are cost-effective options as well. So if you talk to your doctor will be able to give you options. Like for example, now I practice at NGOs where the cost is heavily subsidized by the NGO, right? So my cost in my private clinic and my cost in the NGO will be different. Of course, the service offered will be very different. Like in the NGO, there may be a longer queue for waiting. There may be much longer waiting times for the appointment. There may be a much shorter appointment slot, because we are catering to a much larger crowd there and a much more different demographic there, right? So if you want convenience, if you want comfort, the choice would be probably coming to my private clinic. Yeah. But even then, I've had people come to the clinic, say that they are not able to afford the full fees and can they take a concession for some time, and that's okay. So interestingly, I was the other NGO that I work with, Prafulta, which is a center for psychological well-being at Andheri. We used to do camps for mental health awareness and mental health, sort of like a checkup, right? So we would do a mental health checkup for World Mental Health Day, which is on 10th October every year. We would do the camp. When we started doing the camp, it was a free camp, and people would come and people would get a mental health checkup for themselves, for their families. They would bring the whole family and come. And when we did the camp, after the camp, they would be like, अभी तो आपने suggest किया क्या करना है, इसके बाद क्या करें, you know? And that's when I decided, along with my director, and my director is this very supportive guy. So Father Godfrey, I sat down with him and I said, Father, these patients need to come back to us. Many of them are house helps, on the road, not even able to afford a single meal every day. How will they manage coming to us for treatment? And he said, what do you want to do? And I said, okay, let's do subsidized consultations. And then he said, how much do you want to charge a consultation? So I said, what's the least that we can charge? And he said, 50. I said, okay, chalo. We started it at 50 rupees per consultation, okay? I ran that OPD for around 6 years. That we kept doing.
Quite some time.
Yeah, that OPD. And, there were patients that came that genuinely needed, that we were very happy to help. But there were also those who didn't need it but took advantage of the OPD and said, okay, 50 rupees mein ho raha hai, so why should we pay 1,000 or 1,500? So we did that for some time. It was one of my patients who was an MBA student who came and told me, ma'am, I can't afford 1,500, but 50 is too less. I can afford more than that. So he was like, why don't you do one thing? Instead of saying 50 rupees, you ask the patient how much they will be able to pay. And we stopped the 50 rupee OPD at that point of time. We said, how much can you pay? So now most of the time people say 1,000, 800, 700, 500. And I'm like,
bhar sakte ho tum bharo.
And there are those who say, I can only manage 100, and even those are welcome. But now, because also, when we are doing charitable OPD, we need to justify that it is going to the right person. So we ask them to give income documents, or we ask them to give a supporting proof of why they need that concession and how long they need the concession. So now it's a bit more fair distribution, I think. Now we've moved to that OPD where we're like, okay, you tell me how much you can afford and we will work with that. And then every year we revisit and we say, okay, do you feel that you can come up to the regular charges now? And most of the time they are like, okay, now I'm earning, I'm okay to pay your full fees. And that's really sweet. So we come to that. So it's not as unaffordable as people think. Every one of the practitioners that I work with are willing to make a concession. It's a question of finding the right fit. Go to the right professional, find the right fit, make sure that you get the help that is needed.
What is the percentage, generally of rural areas with respect to, urban areas of people coming to this particular section of getting them treated, or, is it different, or you find it equally balanced out?
No, not at all. In fact, today, urban areas, if say maybe 5% of the population is reaching out and taking help, and it's that less, it's not really...
5% is really less.
Yeah, it's not a big number at all. And 5% is the optimistic outlook, yeah? So even if in urban areas that's the population, I think in rural areas it's much lesser than that. So since 2022, I have been doing an OPD which we run as part of the NGO work with Prafulta, with another NGO called the Banyan. We do that in a small village near Shahpur, okay? Aghai.
Asangao?
Asangao side. So Aghai village. At Aghai village, for our team to reach there, it takes about an hour and a half. And bearing 30 minutes, which is like urban, the rest of it is completely rural and village, okay? So the team, which includes a psychiatrist, a psychologist, and the cab driver that ferries them up and down, we've tied up with a local cab guy who takes us up and down every Sunday. The team sees 60 to 70 patients every Sunday. So they start at 10, they finish at 1 or 1:30. They see 60 to 70 patients in that time. They have lunch and they leave from Aghai and come back. So it's a full day that they've invested, okay? There are patients that walk 15 kilometers to come and see the doctor there. Because there's no psychiatrist available. Unless they come to Thane city. Right? Which is easily 30-40 kilometers. More than that, I think, for them.
That also, I think it is really accessible to these areas. If you go even deeper down, I don't think...
It's not.
Yeah.
It's not. So access is a huge problem in rural areas. Sometimes I've had patients from Latur, from Osmanabad, from different pockets of Maharashtra that brought their relative to me in Thane, felt better, and now they are like, तुम्ही फोनवर कन्सल्ट कराल का? Will you do a video consultation with us? And they've been following up on video consultations for 5 years. And now suddenly they're like, okay, we're coming to Mumbai, so we'll come and meet you, which is so nice when we get to see them in person. But that's the status of our country. Like when I did my MBBS and when we did our rural postings, it was saddening to see the lack of resources across the country. And I think that picture hasn't changed
2025 also it hasn't.
significantly. No.
The global mental health market that is there is estimated to be at $500 billion by 2030. Even the startups are gaining strength around that. So any take on that, like how is India going to approach, or psychiatrists like y'all who are wanting to set up more businesses around this? I just wanted to understand how would you motivate, or how would this go into, which direction would this go into, say later in 10 years or so?
For the mental health space, the need is definitely there. That is why it's booming right now, right? Almost every second person that you meet is struggling with some kind of stressor or the other, whether it is finances, whether it's relationships, whether it's dealing with the challenges that come their way, health-related challenges. So multiple challenges, reduced social supports. Earlier we had joint families where there was much more support systems that were available. Today that's shifting to a nuclear family setup. Today there's so much more multitasking that is required. Times are so short. Like I don't see me and my husband spending as much relaxed time as home as I know my parents would. So comparatively, the demand on work, the demand in terms of the efforts that you need to put in, and the relaxation and the relief that you get, that is very disproportionate, right? So naturally, stress levels are way high, and people are showing repercussions of that stress in their day-to-day lives, because of which there is a need for more mental health professionals. Okay, we are a country of such a huge population with a very small 0.7% psychiatrists per 1,000 of the population. It's crazy, right? And it is something that we are struggling to achieve a balance in. And where there aren't enough psychiatrists, there are psychologists, there are other mental health professionals. But the need for good quality mental health services is definitely felt all across, right? So it is going to be important, whether it is startups, whether it is doctors that want to establish their own practices, to look at this space as something that would potentially grow in the next few years. And therefore, when they start off only, to think about, okay, where is this going to be in 10 years' time, and how do I want to grow this particular practice into that, 10 years down the line.
Post-COVID, has this space gained, traction, or the funding that has been coming onto this space, is it growing more, or the realization of understanding of people that, okay, I need mental health, I need that doctor, has it increased post-COVID?
I don't think the need has increased post-COVID. The need was always there. I think the awareness has increased post-COVID. During COVID, there were so many webinars, sessions, online programs that help people realize the importance. The second reason was, we all were struggling with different challenges, but we somehow juggled between them because we left the home and we went outside. It's only when we were stuck within those four walls that we realized that, oh, everything is not as rosy as we thought. We are not that one big happy family that is seen in, some of the Hindi movies.
Yes.
Yeah, that it's not like that.
Saath hai.
हाँ, मतलब pictures में yes, Insta पे definitely, but not in real life. So that's when people started introspecting, thinking. Some of the people that are really aware started seeking help. Some had to take help because there was no other option. It reached a critical point where there was a need for help. Okay, so invariably people come to us only when it reaches a critical point where there is a extreme challenge, and that's when they feel that they need to take help. Otherwise, people don't really reach out very proactively. Okay, so out of say all the patients that come into my clinic, 95% of them will be at the point where medications are required. There's only a small proportion, 1 to 5%, that will come at a point where it is early stages, and I'll be like, okay, you can go to therapy and you can start with therapy, and if it doesn't work in 3 months, then you come back to me. But that's a very small proportion of the population, because majority of them wait.
Do they realize it before the other patients do, or they just,
Yeah, either they're
work with
aware.
their instincts?
Yes, either they're aware, they've had experience with somebody else because of which they feel that they need to take help earlier, or they've read up enough, they've been more tuned to what their body is going through, and they reach out and take help.
What about corporate training? Is it booming right now with respect to mental health as well? Because throughout we see a lot of stress among the working professionals as well. There are so-called VCs or startup owners. We know very well who ask for people to work for 70-80 hours per week, and that is really causing stress, I guess. So we recently saw an interview by Mr. Narayan Murthy, who mentioned that individuals should work for at least 80 hours. Being a working professional, they also have to balance their work-life balance. So this particular word, work-life balance, it has to be literally, said and done. You have to really work with it.
So I agree that right now work life has become extremely hectic. I agree to that completely, because I see a lot of the patients that come into the clinic that are talking about the stress that they face at work. Yeah. But I also understand that a significant proportion of this is because some people are doing things that they don't really enjoy doing. Okay. So one huge chunk of work-life balance is that doing what you love doing, right? Because either if you choose what you would like to do and then grow in that space, which is ideal, of course, but sometimes you don't get that fit and you have to take up something. And then since you are in that space, you grow to love that space. Ki this is how I would like to work. But having said that, I don't really think it is possible to always have work-life balance. That's like a mythical place that we can live in, but that's not real. What is real is there are set-offs. There are days when work takes precedence and you will be working crazy hours. Like, for example, if I'm taking a holiday, right now I have a 3-week holiday planned in May. Okay, so 10th May is when I'm leaving. 10th May say I've closed all OPDs. I know that 1st to 10th May will be mad. Will be completely busy for me, right? Similarly, when I come back, it'll be packed. So those days I will work, I think, almost 9 hours, 10 hours in the clinic. Some days it has even gone to 12 hours at times. So there are offsets that we have to take, right? But I know that my 3 weeks of vacation, I will not look at anything. I will continuously be focused on my children, the plan that we have, the activities, whatever we have designed for that particular workshop. So for me, the idea of work-life balance is being able to do whatever you like to do within the constraints of the things that you want to do, right? So I love my work. I get to give my 100% when I'm at work. But when I'm at home, my 100% is for my family. So being able to juggle that and balance that, yeah. It's easier for me because my work involves being in the clinic, right? But I know that a lot of people also work from home. So what helps is then delineating. Right? So when I am, say, with the family, I will give my family my 100% at that point of time. And say, suppose I do have to do some work-related task at home, I take the time off. I say, okay, I need 1 hour to do this, to focus on this, and then sit down and complete that. And then come back to whatever you needed to do. I think that might be effective, because otherwise we're just working half-heartedly in both areas. Neither giving our best here nor giving our best there. And that will not work at all in the longer run.
So focus is what is needed.
Yes.
Even if you're on a vacation, so focus on the vacation.
On the vacation, absolutely.
Yeah. There is this buzz of, starting businesses, getting your own identity. Since it's the startup owner's baby, the startup owner would want to work 24/7, Sundays also. मैं तो message कर दूंगा, मैं तो ये कर दूंगा, I'll take the call and all that. So उसके लिए वो stress नहीं है. There are owners who expect them also to be active. Yeah. So because you are also running a established clinic right now, you have so many people, you have 17, 18 members who are working for you, your people there. So any advice for them and the owners?
It is a very scary and a very, how do I say it? It's scary, but at the same time, it's a very exciting journey as a startup owner, right? Because you're doing something that very few would have thought of, very few would have had the courage to try out. And you're putting your hands in a place that people have been scared to explore or scared to look at in the past, right? So it's not a very easy path as an owner, as a founder. There are a lot of self-doubts, there are a lot of self-criticism that comes up. There's always like, I should have known this better, I should have handled this better, I should have managed more effectively. Those questions not even questions, they're actually statements and judgments that keep coming in your mind, that keep happening. What I want founders and owners to understand is that you are the guiding light or the force behind the entire organization, right? So it's so much more important that you are in the right mind frame so that you can direct and orchestrate the entire performance of your organization to the goals that you are directing them towards, okay? So if you're not in good mental health shape, then what happens is there are unreasonable demands put on your employees. There are crazy deadlines that are set. There is expectation to work at timelines that are unrealistic and not manageable, because of which your employees will reach burnout very fast and they will lose their faith in the process. The reason you are a leader is because people looked at you, felt inspired, felt motivated and said, I want to work for this person, right? The chances that they will continue working for you is higher when their energy is high. So what can you do to ensure that their energy is high? One, you need to be in the best mental health shape for yourself as well. If you're not in good shape, and I've seen this happening to so many founders, because they come to me with anxiety, with panic attacks, with depression, and the constant fear is that I can't show this face to my employees because they will get scared and they will crumble, which I understand, which I absolutely understand. That out there you have to have a face that is firm, that is strong, that is resilient. But you also have to feel that from within, right? Because if you expect your employees to talk to you with respect and not get angry and respond to things quickly, is that also how you are talking to them? Because they learn from you.
They say that leadership is loneliness, so like you mentioned, they cannot share it with everybody. You cannot share that aaj salary nahi de sakte, salary 15 din baad aayega.
Yes.
So all these kind of things, just a basic example that I gave.
That loneliness can be quite scary for founders because, right, like you rightly said, I can't discuss that with my employees. I can't talk to them about it, and I can't be at a personal level connected with them, because if I'm connected very personally, I may find it emotionally difficult to take that decision, which was necessary in that moment, right? But I also feel that today the culture, like if we're looking at the new generation coming and working for us, they want to work for more real bosses. They want to see the authenticity, they want to see the genuineness, they want to see you struggle, fall and pick yourself up and still continue. That's what they want to see. So if you're looking at working with a newer generation, then you may need to change the approach a little bit, because they might, they're okay with a boss that makes mistakes as long as, they're on that learning curve and they're growing along with that, making mistakes, because that's how they see the world. That's their view, right? With the seniors, you may need to have a slightly different approach. You may need to work more as a mentor with them rather than a very directive approach, because they may already have a wealth of experience that they're coming to you with. So you sitting down as a young founder and saying, tum ye karo, tum aise karo, tum waise karo, is not going to go down very well with them, because they have had 20 years, 30 years of experience doing something that you weren't even born to see.
In that particular field,
they are domain
they are
experts.
hired. Yeah.
Absolutely. So they're more shaping, more, guiding work is required rather than actual directive work. But so you will need to modulate the way you're working with people. For the loneliness part, I feel that it is important to build really strong networks of connection. So with the family, like that is one of our sounding boards. Whenever I was facing a challenge with some of the staff at the clinic, and I sit down with Denver and I tell him, hey, this is what I'm dealing with, and how would you handle it? How would I handle it? We have a good support system of friends, and business owners talking to each other always helps, because all of us are dealing with the same problems. So when we talk to each other, it's so helpful to say, acha, this is how you manage the staff at your clinic, this is how I manage the staff at my clinic, and we learn from each other and we grow together because of that learning. So talking to my friends who've had clinics, who are running them for 5 years, 10 years, how they navigated certain challenges. So this is again one area that is helpful. And sometimes, we get caught up in the work that we're doing and we don't leave space for this kind of connection. I think it's very important to make that time.
Networking is important.
Yes, but networking not from the purpose of business generation, networking from the purpose of social support, to be able to manage, and that is huge, because when you have a solid team at your back, you don't have to worry about anything. Like today I can say that I'm going for a 3-week holiday because I know that the clinic will be taken care of in my absence. I don't have to sit there and micromanage and navigate. अच्छा तुमने ये किया, अच्छा तुमने ये नहीं किया, अरे ये क्यों नहीं किया. I can't be doing that on my holiday, right? So it is important that you build that network and you build that. And I agree, it's not easy. I mean, even when we are finding the reception staff for the clinic, I think we've run through so many because somehow it was not a fit. Either they were not comfortable with the software, and I was very keen that they use the software, because I said, wo manual haath se likhna, too many errors, and who's going to check it, right? So getting them trained on the software, getting them used to texting, because people are qualified in a particular language, but texting becomes a little bit of a challenge sometimes. And so they are like, I can text in a regional language, but I cannot text in English. So basic challenges that people were facing in terms of managing routine work required that they, we keep learning on the go. Yeah. But I think it takes time to slowly build that setup. And I remember this one assistant who came to the clinic and told me, मैम कुछ नहीं, 10 दिन में मैं पूरा क्लिनिक चलाऊंगा. एंड आई वाज लाइक ठीक है, लाइक 3 महीने देते हैं, लेट्स सी कैसे होता है, बिकॉज 10 दिन is too short a time. So as a founder, I should know that okay, the person is saying 10 दिन, but logically 10 दिन में नहीं होने वाला है. तो I need to have a more practical, more reality oriented understanding of what it is going to be, because then in 3 months, I know that my staff will be properly trained. And I won't scream at them in 1 month and 2 months कि अब तक तुमको ये क्यों नहीं आ रहा है, right? Because I am patiently giving them the time to learn. But at 3 months, if they've not learned, then maybe it's time for me to look for somebody new.
Yes.
Yeah. So it is important to be very real.
Able to?
No, unfortunately not. We gave him 6 months, but unfortunately not. We had to let him go. So the thing is that your people may not be aware, but you should be aware of what their strengths and what their weaknesses are, and then as a leader you guide them into what is the best fit. Incidentally, he was more interested in editing YouTube videos, so I told him, maybe that's your thing, maybe this is not your thing at all, and that's okay.
Yes.
It's fine that you don't fit with us. It's okay, you go on and find your thing, and we'll figure out along the way, we'll find somebody who fits our need.
Talking about branding, nowadays, like you already mentioned some time back, that doctors are also going online on social media promoting themselves on Instagram, Facebook. Are you also doing that? And is that helping you out, in attending customers or genuine patients that would like to come to you, get treated? And also building the networking around, like with the aligned founders that you have.
This is something that has taken the whole social media space by storm, because you can see medical experts, doctors in various fields, talking about common concerns that their patients come to them with, And I think it's really nice because many patients have similar concerns. So that, for me, I am repeating the same thing to every patient that comes with anxiety. When I put it up on social media, it's so much more accessible to so many more people and it can help serve that purpose, right? So I think that it's definitely a huge plus. The work that I do is very word of mouth. Because in mental health, people come to you only when you are recommended by somebody they trust, right? So I have got a few patients, but that would be a very small number of patients. My majority referrals are word of mouth from family members, professionals, friends, and family, whoever felt that they were benefited or they heard of me from somebody and then they've come to me. Okay. And that's, I think, the best way that you can grow your network, right? Because that's a very organic way of growing your practice. I have, of course, been running a page on Instagram where I talk about common mental health related concerns. I share a little bit about what I do. So it was very clear in my mind at that point of time that what I want is to disseminate information only, to spread awareness about mental
Knowledge
health.
about.
That's it. The idea was that it was not to gain followers. So I haven't done anything from that perspective in terms of marketing it, or I used to do these ask me anythings which were really fun. People would keep asking questions and I would enjoy answering them. I think I'll restart that. If it helps the professionals that are working with me get some visibility and showcase their work, then that's an add-on that happens. So most of the people that I know that are working with me are also doing work like this only. They speak on their social media as and when they feel the need to create awareness about something. There are some of us who are extremely social media shy and who, even if I shake them and make them sit in front of a camera, will
I'll
not
not go.
Yeah, will not go at all.
What's the use?
Yes. And I have quite a few social media influencers as my patients as well. And the pressure that they deal with every day is insane. Because I'm creating content, there's somebody else who's creating better content, faster content, much more quicker than me. And I have to keep up. It's insane. So I feel there is a whole bubble of, we're connected with so many people, but are we really connected with them? Because we're not really connected with them. They don't know the real you. They don't know who you are. They don't know how you will
Working.
how
process
you
of
will
working?
work in that process. And that creates a lot of confusion, I think, at times, and misunderstandings at times. So even if you do think that you want to create your persona in terms of social media presence, branding, publicity, go ahead and do it, but be as authentic as possible. Because today that's what carries the most amount of value, and tomorrow people will be more forgiving to your faults if they realize that you are a genuine person and you're not someone who's created this image of being absolutely perfect in different areas and falters in a major area.
It's always said that men don't need to cry, men don't need to share their emotions, and they have to be that strong person throughout in the family. They cannot be sharing their most vulnerable moments. Any advice or any hope of light for the men watching this show?
I come from that belief that both men and women are designed to do what they're designed to do, right? Matlab, me and my husband were having this conversation a few days ago. See, we as women are competing in different areas. We are meeting them at par with different areas. But when it comes to absolute physical strength, they win hands down.
Yes.
Right? Similarly, when it comes to multitasking, we win hands down. There's no two ways about it. When it comes to emotional health, people automatically gravitate towards women because there's a motherly, womanly, feminine touch to it, which they feel they associate with comfort. Yeah, I've seen some of my male colleagues exhibit empathy without a touch of feminism, right? So being able to do without a touch of femininity, let me say that, very confidently, very assertively. Okay, so I feel it is more about the kind of qualities that we associate with ourselves, right? And traditionally we've put a lot of emphasis on men being providers,
Yes.
being the strength, the solid support that has to be there. Like, for example, I talked about my early days. I got married and I went to Mangalore to study, but I went on the rock solid belief that my husband will provide. Right? If I had to worry about okay, मेरा हर रोज का खाना कहाँ से आएगा, where do I pay my fees from, do I depend on my parents and take a loan and everything to manage it, I probably wouldn't have been able to manage the whole thing. So there was that solid backing that my husband gave me that helped me make what I did at the start. So I agree that the pressure on men is definitely there in terms of that they have to provide.
Finances, yeah.
And my batchmates also, you know, when we were talking about PG, some of them were like, we don't have the option of doing PG in the field that we would choose because we need to start earning fast. So
and medical
is anyways a long course,
is a
like
longer
5.5 years you're doing
तो
graduation,
उतने
फिर उसके
time
बाद
में engineering हो जाता है,
and
उतने
people
time
are
में-
earning, like by the time we are
हाँ.
in our 4th year, people are earning,
and
our
also
batchmates.
after that you are just what do you call
Just a graduate, yes.
fellowship or something like that, and whereas an engineer or a BCom graduate would be working somewhere earning 20,000-25,000,
Correct.
which is not the case with this particular field.
So as a basic qualification, they were already worried ki I have a full family to support. They have sent me with all their hopes and aspirations. They have sent me with probably all the savings of the family to study MBBS, and abhi I have to earn and provide for them. So the pressure is crazy, and let's accept that that is what is expected, right? Today things are a little different. So with a partner that supports you, you can probably, you know, both partners can maybe help balance financial goals, can help balance certain things together. But the emotional support part, that is still something that people struggle to take help with. So that is something that I would encourage. It doesn't have to be men. Anybody that is struggling with emotional distress, to reach out and take help, right? We see so many models for us. Virat Kohli speaking about his challenges, Deepika talking about the challenges that she faced, and then going on to found Live Love Laugh Foundation. So many other senior, you know, industry people, senior film stars, celebrities, talking about their challenges and their difficulties and how they navigated it and then reached a point where they were able to bounce back.
And when these people are so famous, they have so much of money.
Absolutely.
So money is not at all a problem there.
To us, it feels like,
Yeah.
oh, they have the perfect life,
Yeah,
but they
it's
have
not.
challenges too.
Yes.
And that makes it very real. So for us also, the learning is that if I'm going through something, to be able to say, yes, I'm struggling with this. Can I take help for this? Who is the right person that I should take help from? And very importantly, if I'm taking help from somebody, I give it enough time. And at the end of that time, if I don't see a change, am I willing to look at other options and consider other possibilities, right? Because I see people stuck in one particular practice that they've taken. Like, for example, suppose they've said that, oh, I want to practice yoga to deal with my mental health, right? It's great. Yoga is a fantastic way to manage your mental health, actually to manage your mental well-being, right? But if it is illness, if it is depression and if it is anxiety, then yoga may not be the right tool for you to manage it. Like a specialist, like a psychiatrist or a psychologist, and they will guide you. And once you are better, you can go back to your yoga practice and that will help you. But in illness time, am I ready to take the necessary help? And am I ready to consider the opinion of the professional for that? Because I think mental health is the only space where patients come and tell us what we should tell them. They come and tell us that नहीं आप दवाई लोगे नहीं आप हर हफ्ते काउंसलर को मिलोगे नहीं आप ये बिहेवियर चेंज करोगे नहीं
तो negative
लेकिन मुझे
ज़्यादा ही
ठीक
आ रहा
होना है
हाँ ठीक होना है लेकिन कुछ करना नहीं है
या सो दिस इज आई टेल माय पेशेंट कि आपको लिखना है मैं प्रिस्क्रिप्शन पैड आपको दे दूँ आप लिख दो जो दवाई देना है आपको बिकॉज आप मेरी बात तो सुनने वाले नहीं हो सो इट इज आई थिंक द ओनली स्पेस वेयर एवरीबडी फील्स क्वालिफाइड टू ऑफर एन ओपिनियन एवरीबडी फील्स दे आर एन एक्सपर्ट
देख ऐसा कर ले वैसा कर ले
इससे सब ठीक हो जाएगा so the approach is very very different. So I think when it comes to mental health, finding the right professional to help you also might be one of the important steps.
Anything for the women?
I think for the women the guilt is often too much because you know we are balancing so many things together and invariably we fall short in some area. And then we compare ourselves with other women who are doing so much better than us. I remember having this conversation with my husband after my MD results, okay? So me and my colleague Dr. Prima, who sits with me at the clinic now, we were batchmates and we appeared the MD exams together, okay? And Prima got the first rank and I got the second rank. And I remember getting so upset that I got second rank in college and crying about it when the result came.
3 Idiots wala ho gaya.
Ha, like getting so upset about it and crying. And I was in the car with Denver when I got the result and we looked at the scores and I was like, okay, Prima came first and I came second. And and he's like, are you crying? So I was like, yeah, a little bit, because I really worked really hard for this. He's like, hello, 1 MD, 2 babies, I think you've done really good. So having that support really made a difference for me, and I think for us women, building that support network is very important. Our husbands, our best friends, my best friends are my constant cheerleaders. They'll keep talking to me. One is sitting in Canada, one is here in Thane, and they'll constantly talk to me and they'll tell me how nice it is for all of us to be together, to share, to discuss things. So I think for us women, that connect is very, very important. In contrast, men will rarely speak to their friends about all these challenges. Like, we face a problem, the first thing we will do is call our best friend and grumble about it for 1 hour. I don't see my husband's friends doing that. They will schedule a meeting after a few months. Let's talk about it after some time. But even then, they won't talk raw emotion, right? Because that's how they are. And I see men who have lost their spouses come to me with intense grief years after they've lost their spouse, because they don't have a sounding board anymore. Their wife was that, their partner was that, and now suddenly that partner's gone and there is nobody that they can sound it out to, because there's so much that is happening and they don't have anybody to talk about it to. And I feel that for all of us, that connectivity is important. So building those networks, in that sense, there are many professional networks that men are part of, but the sharing there in terms of emotional sharing is very, very limited. So when I do corporate trainings and workshops, and when we sit down and we get people to talk about experiences, sometimes they come back and they say that I never thought I will discuss this with my colleague at work, and today you have made me discuss it and it feels amazing.
Yeah.
And I'm like, wow, that's really nice. So we do an active listening exercise, where we tell them that you have to sit in front of your colleague face to face and you have to talk about a challenge that you've been facing at work or at home, whichever one you feel like discussing. For 3 minutes you have to talk. The other person has to only listen and not offer any advice. Okay. And when they do this, and we've taken videos of them talking, the energy and the emotion and the animation with which they talk is amazing, because it's raw emotion, right? They don't have time to practice. They don't have time to ask ChatGPT, what will I say in this situation? They have to, jo aaya man mein wo bol diya. And the other person has to listen to what they are saying. So it is amazing seeing the interplay of emotion there. So I feel that giving these opportunities, creating these spaces where they can talk.
You don't give time to think at all.
Yeah, but you express. I think that has a lot of value, and that may do wonders for all of our mental health.
I was going through some statistics and I found out that the number of men committing suicide is more than the number of women committing suicide. Also, men living longer is not quite there.
Yes.
It's the women who live longer. Does mental health play a part in that?
So with the suicide part, definitely mental health plays a huge role there, and that is something that I've been advocating right since the start of my practice, that when it comes to suicide, we have to have a zero tolerance policy, in the sense that even when somebody vaguely talks about अरे यार जीने में क्या point है, even that should be taken seriously, and it should not be like नहीं कुछ करेगा तो नहीं, ऐसे नहीं लगता मुझे कि कुछ करेगा इसमें, right? We need to be very, very cautious about paying attention to when people around us are giving these cues. A lot of times if you see, and whenever I have debriefed a family after somebody has attempted or completed suicide, there were signs that were there. There were a lot of indicators that were there that told the people that there was something that could have been attended to. It was not viewed from the lens of psychiatry, or it was not viewed from the lens of mental health. It was probably viewed as either laziness, introversion, not wanting to share, not wanting to open up. It was not looked at as a disorder.
As lame as being lazy could have
As
also-
lame as that, right? So the point here is that it is important to look at concerns that you see and address them as soon as possible. Okay. Yes, there is a truth to the fact that more men struggle with mental health challenges, but there are certain illnesses that are more women predominant. And according to the demographic data that we get when we study, we realize, and with the continuing education that happens, we realize which illnesses are more prominent in which section of the population. Okay, so that's something that we look at when we are addressing. And so when a person comes into the clinic, the way they identify, whether they identify as a male or a female, that would make a difference to the way I would look at the illness playing out in the way they are living their life, right? So that's something important. But also the lifestyle disorders that we are seeing today, early onset heart disease, early onset diabetes, cardiovascular
Also hormones
concerns.
play a good role there.
Absolutely. But
Yeah.
our stress levels play a huge impact on our hormones, which in turn plays a huge impact on our illnesses. So all of that is interlinked, and I think it would impact our health in many different ways. So today we are seeing people coming to the emergency department much earlier in life because the stress levels are contributing to lifestyle disorders, which are then creating crisis
So,
situations.
We see heart attacks happening at the age
30.
of 38, 30.
30.
Yeah.
38 is still late now. 30 is what I have heard in the last few years.
Quite traumatizing to hear somebody going by a heart attack at the age of 30.
Absolutely. Imagine just on the verge of getting married, just
Must
getting
have
your
known.
feet set in work, and that's when something like this happens. And now for the rest of your life, you have to follow certain restrictions, guidelines. You can't do so many things that you had on your bucket list.
You were talking about suicides, and you must have seen cases of suicides. How do you, as a person, deal with? Although I understand you've studied psychology and all that, but as a human being, how would you process it?
So like I said, my training in psychiatry never prepared me for the emotional aspect of it. It was the training in psychology as well as the active working with patients that trained me. And then I also did a suicide first responders course, which helped me understand how better to work with patients that come with these concerns and with the families. For me personally, I think the way that I'm able to switch off when I'm outside the clinic, right, that really helps. Because I don't take my work back with me. There are times when I'm really busy with the kids at home and then I won't look at my phone for hours together. So I'm not responded to messages, but when I wake up the next morning, then I give it a little bit of time and I respond to the messages at that point of time. So I think being able to keep that demarcation is very, very important to my mental health.
The Gen Zs right now, they want everything at their their space. They don't want to go out anywhere, so they have access to internet. They have all the AI tools ready for them to work.
Yes.
Yeah. I have colleagues saying that my daughter or my son doesn't want to go to college. So for us, one of the reasons to go to colleges was just to chill out with my friends. Lecture baithe nahi baithe, bunk hua, I'm fine with that. But I want to go chill out with my friends. That thing has also gone right now. So, any advice for the parents or the kids who are, interested in listening to this podcast?
I'll be honest, I'm seeing both ends of the spectrum. I'm seeing the ones that are extremely highly motivated. They're doing 1 degree in college and then they're doing something part-time online and then they're interning somewhere and, everything they want to do, right? So I'm seeing that end of the world as well. And I'm also seeing the ones that are languishing, the ones that are struggling, not even being able to cope up with the minimum that is expected. Okay. What I love about the Gen Z is that, and I work with quite a few of them, many of them are my patients as well. What I absolutely like is that they're very clear about what they want. Whether that will take them to the goals that they eventually want to reach, I don't know. But they're clear about what they want. Like, I was extremely confused at their point in life. They are not that confused right now, which is amazing. They're also not afraid to talk about what they want,
Yes, that's
which I was very scared of. So I admire that, because for me to be able to open up and speak in front of seniors even today is a little scary. Yeah, but I see my Gen Z colleagues, juniors that are working with me, my daughter, very vocal, very expressive about what they want, what they don't want. If they don't want something, they're very clear about it. I remember wearing dresses that I did not like because I was too scared to tell my mother that I can't wear this. But my daughter will straight away tell me, Mama, I'm not wearing this, whether you like it or not. I admire that assertiveness, because you know what? Some of our generation ka mental health struggles are because we cannot speak up. So it's amazing that they are doing that. Okay. What I would love for them to understand is that some things take time. And they will
Yeah.
have to give it that learning and that time. So
They
you can
might be-
hustle, you can grind, you can do all the, churning that you want to do. But some things will need 10 years of working with people, and that is when you will learn how to do certain things. So I definitely would suggest that, the thing is to keep staying with the assertiveness, but to also build in the mindfulness and the patience that you need to work over a period of time. And I think that might be a sweet spot where the Gen Zs and us millennials might be able to help each other, because we can learn assertiveness from them and they can learn some amount of, patience and chill from us. And together, I think it'll be a beautiful synergy, right?
Yeah. Any advice that you would like to give to the medical students who are aspiring to become psychiatrists and consider you as a role model, want to become a psychiatrist, who want to open up a clinic?
It sounds so strange that I am giving advice to medical students who want to become psychiatrists today. But a lot of my answer today has been shaped by the learnings from seniors that I have had the privilege to work with. And many of them have guided me, mentored, supported the decisions that I have made, and, led me down the road that I am at today. So, for those students who are looking to be psychiatrists, I would definitely say that invest the years of your education in understanding the science properly. That is going to be very, very important, because today's population wants facts and wants neuroscientific information very clearly. So invest your study years in properly understanding the science so that you can answer questions as effectively as possible. But also spend time in knowing and understanding yourself, because only when you are able to come in front of them as a genuine human being will they want to come to you as a doctor. Half of our work is done by the patient walking into the clinic and seeing that smile on your face and feeling ki हाँ इनके साथ I will get better, right?
Comfort हो जाता है.
So you as a human being, you as a doctor, two things that you need to invest in. On a very, very practical level, I would tell them that if it is a plan to start a clinic, look at how early it would possibly take for you to start it. Like I've started it 10 years into practice. But I know my friends who started almost as soon as they finished. For various reasons, they had the capacity to start it. I did not have the capacity at that point of time. I gradually built capacity and then I started it. But whenever you start, from that point onwards is when the growth happens, right? Because till then you are still learning the ropes. And when you actually sit in your own space and you learn to manage things on your own, is when you will actually get a grip on things and you will start growing your own name in the field. So as early as possible would be my advice to most of the young psychiatrists who want to start.
Do you have any mentor whom you look up to throughout these years?
So several mentors come to mind. Both my HODs at Father Muller's Medical College. I had Dr. Krishnamurthy at the start, then I had Dr. P. John Mathai, both who shaped the way I would talk to patients and the way I would interact with them. All of the teachers that I had in college, somehow our college was a very, very nice space. There was not a lot of fear of judgment or criticism. There was space to, try and make mistakes and learn from them, and share in front of our seniors, and it was nice. Like we were of course worried about making mistakes, but there was always scope for learning, and there was always uh, that that supporting guide that, no matter what, we are behind you, we will take care of things, which has shaped the way I now run the clinic as well. Like I keep telling the people that come work for me that it's okay, make mistakes, I'm there, I will take care of it, so we will figure out a way to manage it, but unless you make mistakes, you won't learn and you won't grow out of it. So that has definitely shaped the way I practice today. When I moved to Thane, I worked under Dr. Nadkarni for a very long time, and that really helped shape the way I talk to patients, the way I listen to them, and the way I attend to caregivers that I'm working with. So these things have helped in guided me. And my constant mentor through all of this has been my partner Saraswati, with whom I started Catalysts, which is our training company. And Saraswati is my sounding board. Like, I can just go and talk to her and tell her the challenge I'm facing, and then she'll look at me and ask me such an impactful question that will make me think, is this what I want? Is this how I want to go forward? So she's my guide when it comes to day-to-day challenges that I face. Even today, when I'm struggling with something very problematic, she's the one that I go to, and it's only because of these mentors that I'm able to be who I am today.
Any final advice that you would like to give to the listeners of this podcast? And if they have to connect to you or reach out to you, how would they do that?
Okay. So we are available at Catalyst Clinic at Panch Pakhadi and in Thane, and we are also available online, of course. So they can reach out to us. We're on Google Maps. We're easily available on Instagram as well. They can reach out and follow the page Catalyst Clinic. And we're happy. I am happy to connect with anyone who needs support, whether it is people needing mental health support, whether it is young psychiatrists, young medical students looking for their journey into psychiatry. Happy to help and support. You can reach out to me on any of my social media, and I'm happy to see how I can help and support you in that. For those of you who need mental health support, we have a whole team of professionals at the clinic. So you can simply reach out to us over Google, and we're there, or Instagram, and we're happy to set up something for you. I think the only thing that I want to tell everybody as I end this is that your mind is your greatest asset. It is what is controlling almost everything of your body. It decides how your future is going to play out. And if you don't take care of your mind, it will definitely come back and cause a much bigger problem for you in the future. So my take home from this is going to be that you look at what it is that your mind needs to be at the best game that it needs to be at, and do whatever it takes to make sure that it can get you there. So all the best.
Thank you, Dr. Wilona, for joining us for this particular podcast. You shared valuable inputs today about mental health and how we can shape ourselves throughout our work-life balance thing. And the listeners today that would gain so much of knowledge from your background and your journey towards the lifestyle that you have followed and become where you are today. Thank you.
Mental well being isn't a destination, it's a lifelong journey. The more we talk about it, the stronger we become. If today's conversation resonated with you, don't forget to like, comment, and subscribe to the Visionary World podcast. Let's keep the dialogue going and build a healthier, more resilient world together. If you have any questions for Dr. Wilona, please comment below, and she will be happy to answer your questions. Thank you.
Okay. Very interesting. हो गया पॉडकास्ट.
हाँ, this is so much work. इससे तो अच्छा क्लिनिक में बैठूं, पेशेंट देखूं. This is a lot of work.